The issues that we see sometimes with implants as they are right now is that they only come in a limited number of sizes. So when we're placing these implants, sometimes they fit and sometimes they don't. Sometimes they're between sizes. It's similar to a shirt or a pair of pants. So the advantage of Conformis is that since it's made based on that preoperative CAT scan, the implants fit the patient exactly. So when we place either the femoral or tibial implants onto the patient, they just match like an extension of their own anatomy. We all know that patients are different. They come in different sexes, male and female, and all different shapes and sizes. So their needs should as well. And even within an individual person, there can be differences in anatomy. So I think the approach of just making 5 or 6 or 7 different sizes of knee replacements is frankly outdated.